snow is coming.
Well, the 9 o'clock shows don't have time to, do the fancy. All
Yeah.
right. Hey, everyone, and welcome to Chef AJ and Friends. Today, believe it or not, is the third Friday of the month, which means it's time for The Doctor Is In, which is our monthly Q&A with Dr. Ron Weiss. You send in your questions. He answers them. Please welcome all the way from New Jersey, Dr. Ron Weiss. Is it cold where you live now?
It's been very cold, AJ, the past few nights. It's gotten down to 30 degrees, 29 degrees in our valley, 28, and that means that our season is done because we're growing now cool weather crops, but a lot of them, they just can't withstand this cold. So our
Oh my
farm market
goodness.
is winding down. I think our last farm market will be next week, and then that's it.
I am so sorry.
Yeah.
What you were just having
It's
a
all
little
good. That's what happens.
You were just having a little snack. What was it?
Um, so this is a ruby red grapefruit, and my favorite part is the pith.
You're kidding. The
It's the
bitter
white
part?
part. Yes, and the reason why I love it so much is because when my kids were little, they would refuse to eat all this. They would even refuse to eat the membrane, the skin around it. And I would have to painstakingly peel off just to get the pulp. When they were like 3, 4, 5 years old, I'd have to just give them the pulp. And then I'd be left with all this stuff with the membranes, with the white, and that's the part I would eat. So every time when I eat this, it reminds me of my small little children, and that's sweeter to me than the
That's
sweet
a
flesh of it.
that's a very sweet story, but how sweet is the pith? How does it taste?
It's bitter. It's
Yeah.
bitter. However, it's really important. This is that white covering is what endows the grapefruit with the most fiber of any fruit. It's the highest containing fiber fruit. So that's great. I like eating it for a high fiber snack.
I had no idea that grapefruit was the highest fiber containing fruit. See, you learn something new every day on Chef
Because of
AJ and
that,
Friend.
because of the, yeah,
All right. Well, you ready to jump into the questions? We've got
I
some
am.
today. So the first one is from Sarah, who says she's a healthy 64-year-old woman, but she tested positive for the BRCA gene, and her mother survived ovarian and breast cancer, and her sister survived breast cancer. Her gynecologist is strongly suggesting she gets her ovaries removed, and she's leaning towards doing this. Do you have any thoughts on this matter? Is it what you would typically advise a woman in her situation? And we wish you luck with whatever you decide, Sarah.
Yeah. Well, thank you for asking the question, Sarah. And I so what I find a little puzzling, AJ, is Sarah, and I don't know if this is live or if this is a previously submitted question,
It was
what,
submitted on Wednesday. I can look in the chat to see if she is watching live.
okay, the question is, what about the mastectomy? You mentioned that they're only recommending an oophorectomy, like to take the ovaries out, but usually the BRCA gene can increase your risk of a number of things, including breast and ovarian cancer. So they usually, refer, do the recommendation is usually to do mastectomies and ovarian removal. But aside from that, so for people who are just for a little background information, the BRCA gene, a lot of us have heard of before. It is it's actually a good gene to have. We want BRCA genes, and the reason why is because they are tumor suppressor genes. Like, for example, they suppress cancer cells in the breast. And for example, when they are mutated or dysfunctional, uh, a woman with a mutation of this good cancer suppressing gene can have, as much as like a 50% chance of getting cancer during their life. And that's why the prophylactic, excuse me, a little pith stuck in there.
Uh-oh.
And
See?
that's why the prophylactic removal, because the chances of getting cancer are thought to be so high, the recommendation, and we don't know who this is going to happen into if you do have this gene. That's why the standard recommendation is to remove the ovaries and the breasts completely, the tissue completely, so it cannot degenerate into cancer. Um, so um, there at this time there is no other treatment that I know of. You could, if you didn't want to have this done, I in my patients and in my experience, I think most women with this mutation, they elect to have the operations, the mastectomies and the oophorectomies, the ovarian removal performed. What is the other alternative? Well, you could, I guess, constantly surveil, doing MRIs of the breast and constantly doing, let's say, pelvic ultrasounds to constantly look, or maybe MRIs of the pelvis, they may be more accurate, to constantly surveil like every 6 months or every year to see if there are tumors coming up. That would be another option, but you're kind of living on a knife's edge that way because as I said, there's a 50% chance of getting the cancer. What else could you do? I'm The last time I researched this, there were some inklings that eating a diet of whole plant foods, a high quality plant-based diet, could improve the chances of not getting the cancer in women who had the BRCA gene, but I'm not sure we have a lot of data on that. It would make sense to me that this could work, but of course, we're dealing with a potentially grave situation, and that's why I think it's probably best to be conservative and get the surgery. And at the same time, I would adopt a high level diet of whole plant foods. Just as an aside, just to so you can appreciate the mechanism of action by which eating a plant-based diet could help a person who has a BRCA mutation. There are different kinds of BRCA mutations. Just because you have like one kind of BRCA mutation, it doesn't mean all of your good BRCA gene is knocked out. And we've known for years now that eating soy every day, not necessarily for a BRCA patient, mutation patient, but for anyone, helps to prolong survival in breast cancer patients. It helps to prevent breast cancer in people who don't have breast cancer, like especially young girls, if they start eating it at a tender age. It reduces the chance you're going to get breast cancer as an adult. How does the soy do that? There is evidence that the phytoestrogen in soy, which is called genistein, most likely unlocks disused or underused capacity of BRCA, like suppressive capacity of cancer. It unlocks epigenetically these genistein, these soy phytoestrogen molecules go to our BRCA genes and unleash their power to suppress cancer cells. So that's an example of like even eating soy, of how that could increase your chances if you have BRCA, difficulties or inadequacies through these mutations. I just wanted to add that.
Well,
It's
it's
a
interesting.
very
It's
it's a
interesting.
very difficult decision. I'm sorry, Chef AJ.
I
What
didn't
was
mean to
that?
interrupt, but it's interesting that you added that because the next question, which we can talk about either later or at the same time from Leslie, was about tofu and soy. Was that does tofu block estrogen? Does tofu interrupt needed estrogen for women?
Sure, we can get to that next.
Yeah.
But just suffice it to say that you this is an extremely difficult decision. I don't give this advice casually or cavalierly. It's it, you know, so it's a personal decision that has to be made by every woman, and I'm just sharing my thoughts and my experience with other women. Usually, they elect to have it done, and I don't. I think that if I always put myself in the patient's shoes as if I have the disease, that I have the issue. And I think that, I don't know every last detail of your scenario, which is important to know before you make a potentially life altering and a very, you know, profound decision like this. But knowing what I know, I would elect most likely to do this if I had this issue. I would elect to have the surgery.
So did you say that 50% of the people with this gene eventually get these kind of cancers? And if they have the
No, no,
surgery,
no. Is that with the average BRCA mutation regarding breast cancer, it's thought that you have a 50% lifetime chance of getting breast cancer.
so
That's a flip of a coin. A flip of a coin. Do you want to take that? Would you right now flip a coin and take odds on that? Do I get cancer or not? And most women don't want to do that. They don't want to flip a coin and take a chance. So that's why they have the surgery. And the overall conclusion of what I told you is there's some I'm sure by eating soy and doing other things, you can improve your outcome. You can improve those odds by eating plants, not eating things that trigger tumor cell growth, like saturated fats, and which we know does that. Increasing estrogens in your body by eating flaxseed, which helps to decrease tumor cell growth in breast. We know that, but how much, I can't tell you that. I don't know how powerful it's going to be in you. Look, can it be 100%? Can it reduce your? I can't say that. I can not at all can I say that. And I don't know what numbers to give you. And I don't think anyone does. And that's why I think probably taking a conservative approach probably is best. This is a an issue which is very, close to me culturally because I am Jewish. And uh, my father was from Eastern Europe, from Poland, and the Eastern European Jews, the Ashkenazi Jews, have the highest known burden of this mutation in the world of any group of people. It's estimated that up to 4% of all Jewish women of Eastern European extraction have this mutation. So I know it. I feel for you, and I understand the difficulties, and I wish you the best in coming to peace with this and making a good decision.
so if she
But
decided,
that, but an intrinsic part of that good decision is eating whole plant foods. That I can tell you.
I think she already does, but my question is if you gave so much information about breast cancer, but she's saying they only want to remove the ovaries.
I don't know that there's some. Well, because the BRCA mutation also significantly increases your chance of ovarian cancer as well.
I see.
But why she's not commenting about the mastectomy, I don't understand that.
Okay. Well, I mean, if she decides against, we wish her well, whatever she decides, but if she decides against it, they will monitor her, right?
Of
Hopefully.
course. Yeah, I mean, it's of course that if one of my patients decided against it, there are patients who decide not to have it. You would undergo monitoring, and that's when especially a high quality diet of whole plant foods would be extremely important because that does I feel in my bones that it will really give you an edge of really doing something that's concrete to really prevent help to prevent the development of the breast cancer, because you have to remember the surveillance, whether it's by MRIs or you're doing ultrasounds, it doesn't prevent anything. It's just looking for stuff. So the surveillance is one arm of what you would enter, constantly surveilling to make sure if they find something very early, they can act, the doctors can act. But the other half of that is doing what you can do to prevent that development of the tumors. And that would be eating a high quality diet of whole plant foods.
Thank you. So on to the soy question, which you kind of touched on about whether or not tofu blocks estrogen or interrupts needed estrogen for women.
Right. So this is a very common question, and I think the confusion about it goes back many years, and it has to do with the term phytoestrogen. So phyto means plants, and estrogen, we know what that means. The estrogen is the female hormone that we have in ourselves. Um, um, the difficulties come in that there are plants that have estrogen-like molecules in them. They're not estrogens per se, but they are estrogen-like, meaning that they may bind receptors. Receptors are sort of keyholes on cells that are awaiting a matching key that will turn on a certain function in the cell. And we now know that although these phytoestrogens are not really estrogens, they target these receptors, and not all estrogen receptors, certain specific ones that have a beneficial action to us, not a negative estrogen action. Like, for example, what do I mean by that? Without getting into a very complicated molecular biology, um, the bottom line is that the thing that people are concerned about with estrogens effects or stimulatory effects in, for example, women, is that if you have too many estrogens, we know that breast cancer, of which we were just talking about, cells, they're estrogen driven. Estrogen is like a fertilizer to the growth of many breast cancer cells. And these are hormone dependent breast cancers. The vast majority of breast cancers are like this. So, why would you want to give a woman extra, like estrogen or extra fertilizer to make her cancers grow faster? You wouldn't. In fact, the conventional treatment for estrogen dependent breast cancers, with estrogen receptors, is we've got to block all binding of estrogen to these cancer cells, and then they shrink. And that's why women are like premenopausal women or younger women are typically given things like tamoxifen, uh, which is after they get their breast cancers removed, to make sure that the cancers, whatever, if there are any small nests of cancer cells left, they are blocked from getting, by this drug, from getting access to estrogen. But the phytoestrogens, or in other words, plant estrogen-like molecules are not actually estrogens. They bind to some estrogen receptors and then have a beneficial effect. And I just described in the last question how while the main phytoestrogen, which is called genistein, we have elucidated may work, right? Like in that instance, this estrogen like, it's not estrogen again, this plant estrogen compound unleashes extra power in our cancer fighting BRCA genes. So the bottom line is that after years of controversy and scientific exploration, what has been found through evidence-based clinical work is that science is that there's no question anymore. It's that eating soy with its phytoestrogens significantly increases the survival of breast cancer patients who have been already diagnosed, and it helps to prevent breast cancer in women who have not had it. We know that. And it's thought to be, the mechanism is thought to be through these phytoestrogen-like molecules. And here's another news flash in case anyone is unclear about this, that if I had to think of the most powerful foods that treat and prevent breast cancer, soy is one of them. Another one is flaxseed. And flaxseed, the reason why flaxseed is so powerful in its prevention and treatment of breast cancer is, guess why? It has phytoestrogens. They're called lignans or prelignans. They're not genistein. It's a different kind of plant-like estrogen, and they, through the action of these plant-like estrogens, they too have a phenomenally beneficial effect. So, in summary, phytoestrogens, in other words, plant-like configured estrogens, have good effects on us. We should try to get them in our diet, and you shouldn't worry that they're going to have untoward effects on your health.
Thank you. All right, now from soy to mouthwash. This is from Susan, and she says, Dr. Weiss, is mouthwash bad for gut health?
You're such good questions. It's like
Yeah.
every time I come on, and they're so diverse too.
I know, isn't it great?
I know the beautiful curator who's sitting in front of me has a hand in it. So
No, we have a good audience. Thank you.
yes, so that is a great question, and not one that I hear a lot being asked. So I think it's critical. It's critical. So how can I begin here? So in case and I always, AJ, I don't know if you noticed this, but I always like starting off with some background information, because not all of the audience knows everything, right? There may be some new people who are on who maybe they don't really know a lot of the science, or so I like giving, please, for those of you who really know a lot about the microbiome, bear with me through the first minute or so. I'm going to give some background. So what the topic of this question deals with using mouthwashes. And as you probably know, mouthwashes are designed to kill bacteria, right? Like scope or Listerine. You know, Joseph Lister was the first person who described antisepsis, that using carbolic acid and using chemicals could kill germs. And that's what mouthwashes are designed to do. So now that we know that, let's consider our bodies. Our bodies are home to trillions of bacteria, viruses, fungi, other primitive organisms called archaea, protobacteria, all kinds of things. And They all live together, hopefully in harmony, if we have our health, and they are keeping us alive. They are our life support system. And if this ecosystem, if these trillions of organisms, if they become unbalanced or something goes awry, or some of them get killed off, or others take advantage over some of the other members, disease sets in. So, where are these organisms? They cover us, our skin, the outside of us. They also cover our respiratory tract, starting from our noses and sinuses and our upper airways and the throat, going into our lungs. And they cover our GI tract, the intestinal tract. So, as I said, the right ecosystem and balance of this microbial, this microscopic organism is critical. So if you may start to think, well, what exactly am I doing when I take a substance into my mouth which kills bacteria? Well, that's a very good question. And the knee-jerk reaction is don't do that. Don't do that, because quite frankly, these mouthwashes and bactericidal or microbe killing chemicals and substances are not specific to kill off bad organisms. They just kill off organisms. They kill off bad ones and good ones. And you have no choice as to what they're going to kill off. And like I told you, if you're a healthy person, it's okay for you to have some bad organisms, because they're kept in check by the good organisms. What you don't want is to unknowingly and on a wholesale basis just kill off organisms, because that's how you can get out of balance. And I believe that's what mouthwashes do. And guess what else does that, Chef AJ? Alcohol.
Oh, alcohol.
Alcohol. Alcohol does that too. We know that even a teaspoon of alcohol, and guess what mouthwashes have in them? Alcohol.
Alcohol.
Alcohol. And if they don't have alcohol in them, they have other antiseptic agents. In the old days, before we had antibiotics, in the old days, people would sprinkle alcohol on wounds to kill bacteria. So, that's why it's not such a good idea to drink alcohol. Well, there are other reasons too, because it's also a potent cancer-causing agent. Because the alcohol within 5 seconds, 10 seconds of it being in your mouth, turns into a very potent carcinogen. The alcohol molecule breaks down into acetaldehyde, and that's why it causes cancer. And people who drink alcohol, even in mild amounts, have significantly increased risk of getting GI tractors, mouth cancers, stomach cancers, esophageal cancers, throat cancers, and everything, colon cancers, breast cancers. So, but I'm getting off track here. That's the category of microbial or bacteria and microorganism killing stuff. You don't want to undermine your healthy ecosystem and the relationship of the denizens of this beautiful unseen world that is your life support. Don't. I tell my patients, don't use mouthwash. And as an added benefit, tongue scraping. If you want to help the bacteria in your mouth, that action of using a tongue scraper every day probably gives advantage to healthier bacteria and can really help to support the good guys in your mouth, so you can have extra power. And remember, our gut microsystem, apropos to this lady's question, people think about the gut microbiome as being in the colon. It starts here. It starts in the mouth. right? That's the first step of a digestion. So I do not advise mouthwash.
Thank
And the
you.
question, AJ, is why would someone need to use mouthwash in the first place?
Because
If
they're,
it's because of halitosis, that's the medical name of bad breath. Well, bad breath usually comes from tongue debris. So by using the tongue scraper, you won't have a need to use mouthwash in any of it.
thank you.
Yeah.
Next question is about blood pressure cuffs. And Jane says, I would like to buy a blood pressure cuff for at-home use. Is there a brand you would recommend? I just got one at, because, when you have virtual appointments in California, you have to take your blood pressure first because, I just got one at CVS.
Sure.
And it's real easy. It seems
It
to
is
work.
very easy.
Yeah.
So I also make this recommendation to all my patients. I think it's a fantastic and handy device. When I first became a doctor, we didn't have things. These things were not available to the public. There were no. I think that you could go into a pharmacy and they had this big like public machine. You could put your arm in it. We had arm cuffs that were used by doctors, but you can't take your own blood pressure with. It's very difficult with your own arm cuff. It's difficult to do it on yourself. And then in more recent times, these home automatic, nifty, compact little blood pressure kits like the one you just showed, AJ, came on market, and they're fantastic. I find if you have a good one, they are just as accurate as my professional hand machine that I use in the office. And the reason why I know this is because I often ask the patients to bring their machine in to the visit with me, and then we get side by side measurements to ensure the accuracy of the home devices. And we always get blood pressures that are consistent. The home machines always pretty much get the same blood pressures that I get here in the office. So I know they're valid. Um, so the blood pressure machine, there may be many different brands. The one that I'm used to and the one that I usually tell patients to get is Omron, Omron. It's a popular brand. It's reasonably priced. I would get the arm band. They make wristband and arm band blood pressures. I would get the arm cuff or band blood pressure because I think it's a little bit more accurate. And it's cheap. I don't know. It's somewhere in the neighborhood of $50 or something like that, $60. So I think it's a great value. And even if you don't have hypertension, um, so hypertension is defined as a systolic or upper blood pressure, top blood pressure of the fraction, like 120/80. The top number is 130 or more. That's called hypertension. If it's 140 or more, a conventional doctor will put you on blood pressure medications for your hypertension. For the bottom number, it should be hypertension is, well, there's pre-hypertension, which is designated as 180 to 189. Oh, I'm sorry, 80 to 89. And hypertension, which gets drugs, is at 90 and more. And I'm sorry, there's a pre-hypertension category for the top number, the systolic, and that's 120 to 129. So what I'm saying is, in order to have normal, what's defined as normal blood pressure, um, you need to have a blood pressure of less than 120 for the top and less than 80 for the bottom. And so I think it's a nice thing, especially as you get older, maybe middle age. I think it's nice to have a blood pressure cuff around and take it once in a while. Even if you have let's say, even if you have a great blood pressure, let's say it's 105/60 or 70, I like having it around because you can keep your eye on it to make sure it doesn't then climb to 110 and then it climbs to 115 and then it climbs to 118, because if it's going up, it means maybe your lifestyle is not so good. because blood pressure should not, if everything is correct with diet and lifestyle and your sleep and all the other pillars of lifestyle, your blood pressure should remain low lifelong. It should not be inching up. So that's why I tell people with blood pressure problems and people without blood pressure problems, it's nice to have a blood pressure cuffing.
Thank you. I always wonder, I used to be, God, over 40 years ago as a respiratory therapist. And when we took blood pressure, we did it, with our stethoscope. And now it seems they only do it with the machine. Is that old-fashioned way actually more accurate?
Well, in the beginning, when I started off my career, it was in the emergency room. I was an ER doctor. And I remember that was the first time, the first clinical use of automatic blood pressures came in because, in the ER, we were so busy. The nurses stopped getting blood. They would stop. This was I think it was in the early 90s. The nurses threw away their stethoscopes, like you were saying, AJ, the ER nurses, and started just wrapping a cuff and doing an automatic blood pressure on people. And I noticed that sometimes they were not that accurate, but the accuracy has improved with time. But still, I like getting a hand blood pressure. In the office setting or in, tense situations, I like getting it by hand. But I think, and using the stethoscope to hear, that's the way, the old fashioned way is done. But suffice it to say, I think for home purposes, under no duress, everything is calm, you're relaxed. I think that these home models without the stethoscope are fine.
Thank you. So Kay, who's watching live, would like to know how she can have a virtual consult with you. Do you do that? And do they have to live in the state of New York or New Jersey for this?
We do telemedicine, but in order for me to take care of people, you need to have a residency in the state of New York and New Jersey, because that's where I'm licensed. Doctors cannot, they're prohibited by law from taking care of people unless one of two things happen. The doctor has to have a license in the state where you have your residence, or else you have to come to see the doctor for the visit. So either one of those.
Because in case you don't know, we're multi-streaming. This is a YouTube show, but it also goes on to several Facebook places and Twitter and YouTube and Instagram, that is. So I just saw a comment or a question from someone watching live on Instagram, and they're asking, what's the lifetime risk of developing breast cancer in women who do not have the BRCA gene?
Yeah, that's a sore point. So when I graduated medical school, New Jersey Medical School in 1988, one out of every 11 women would be diagnosed during their lifetime in the United States with breast cancer. Today, it's 1 in 8.
Wow.
1 in 8. So I can give you, let me divide 1 by 11, and I will give you let me divide currently 1 divided by 8. So today it's a 13% chance. It used to be, when I graduated medical school, it used to be a 9% chance. So it went up by more than a third. Do you know why, AJ? Why has, but I have been a doctor for something like 36 years. Guess why the incidence of breast cancer has increased by a third, more than a third? Is it the food?
I don't know.
Is it chemicals in the environment?
Maybe all of the above.
Yeah, maybe, but who knows? But I highly suspect the reason is because of breast cancer screening prevention programs. They've gotten very aggressive. I remember when not all women would get breast mammograms when I was in medical school, and today basically almost every woman that I know, almost everyone, the vast majority, are in regular mammogram screening programs. And we know now that when that breast cancer screening programs that employ mammograms do not do anything to save lives, and actually they do increase the diagnosis of breast cancer. And over my lifetime as a physician, they've gotten very aggressive. They've gotten more aggressive than they were, and that's why, most likely, that's the explanation as to why there's a third more chance of you getting breast cancer now than when I graduated 36 years ago.
Thank you.
Yes, I understand there's a lot more obesity. I understand everyone's eating crap. I understand, there's the food is worse, and that doesn't help because breast cancers are basically dietary driven diseases. But that's in there somewhere, but probably the majority of it is from overly aggressive breast cancer screening.
Interesting. Thank you. All right. Well, this just in through the help desk. This is from, I don't see, Krista. She has a problem with, I think it's an eye twitch. So she's 63, whole food, plant-based, sugar and oil free, occasionally a little salt. And she is predominantly whole food plant-based 15 years. She's been having a twitch in one eyelid for about 6 weeks, especially when she's outside in the sunshine, but even when resting with her eyes closed. She's also had a few twitches elsewhere, but they're seldom and inconsistent. They're annoying and worrisome. What could be causing such a thing, and what can she do to get rid of them?
So there is a condition, I don't, I can put you in this category. I call it blepharospasm. There is an orbicularis muscle. It's a muscle, it's a circular, very thin muscular layer that surrounds the orbit, that surrounds the eye, that covers over the orbit. And sometimes that and the the muscles in the eyelid they can go into spasm. And then they cause this twitching, this sudden twitching like feeling. And you can actually see the eyelid muscles and the muscle around the eye twitching. It's thought to be due to the following factors. Three things: caffeine use, so sleep disruption, and stress. So I've noticed in my patients that when you address those three issues, you make sure that the sleep is correct and restorative, that you get rid of all caffeine and coffee, and that when you moderate stress, that it will go away. That's it. And I can tell you that I had that once in my life too. I think it was many years ago, maybe about 20 when my kids were little. I think it's when they weren't sleeping when they were babies. And I remember I got that twitching around my eye. And it lasted until they started to sleep through the night. And when they started to sleep through the night, then it went away. Then I slept through the night.
Nice. Thank you. Hey, this is a question on Roundup from Elizabeth. She says she loves me and Charles and our show so much. Thanks so much. She says she has an old container of Roundup sitting in her storage shed with about 2.5 gallons of Roundup in it. Husband bought it many years ago before he knew how dangerous it was. What should we do with it now?
Yeah. Well, personally, I would contact your municipality and I would, ask them, you should treat it as a toxic substance. And usually most towns would have have a protocol for collecting and disposing of toxic chemicals. And I would treat it as such. It as it's sitting in your garage, it's fairly, inert. It's just sitting in a bottle. Um, but I guess if you want to get rid of, I definitely wouldn't use it because it's a cancer causing agent. So I would no longer use it on your lawn. It also gets into our environment, and we know it has bad effects on other, members of our ecosystem. So if you just want to keep it indefinitely and so it doesn't go anywhere, I guess you could do that. But at some point, you're going to have to get rid of it. And I would call your municipality and deal with it as a toxic substance. And just as an aside, just some little background information on the Roundup. It is the number one pesticide. When I say pesticide, I don't necessarily mean only insecticides, chemicals that kill insects. When I say pesticide, what I'm really saying is a biocide. It's a life killer. And the pesticides are life killers, the biocides. I include all of the fungicides, the insecticides, the weed killers or herbicides. All of those are all under that one umbrella. So Roundup is an herbicide. It kills plants and it's used for weeds. It is the number one pesticide used in the nation, probably the world, I believe, at this point. But in the United States alone, we utilize hundreds of millions of pounds of it every year through industrialized agriculture, in conventional industrialized agriculture. And it's gotten to the point where there is so much Roundup in our environment that when you look at raindrops falling from the sky, they have Roundup in them. When you eat wheat or a grain or a bean that's not organic, it has Roundup in it. So there's Roundup contaminating most of our food supply and us. We have Roundup, most of us have Roundup flowing out of ourselves. So if you want to avoid this horrific chemical, which is presumed or it's suspected by the World Health Organization of being a cancer-causing agent, there's a high suspicion for it. I would eat organically certified food to avoid it. And better yet, even regeneratively organic food, if you can get your hands on that. And avoid spraying it on your lawn and avoid killing weeds because we need a different approach to supporting life instead of killing life. So get rid of it.
Thank you. So she also wants you to know, I guess we had talked about toothpaste in a previous episode, that she found one that works better for sensitive teeth than fluoride toothpaste called BOKA nanohydroxapatite toothpaste. Comes in several delicious flavors. Her favorite is the cinnamon flavor.
Excellent. Hydroxyapatite. Right. That would help to maybe help to support enamel on our teeth so it doesn't wear down. Good. Thank you for that information.
Okay. I think we have time for one more question.
Good.
This is from Julie. and it's about rebounding on a trampoline. Do you find that rebounding to have any benefits, but are there any negatives? Years ago, I heard concern being raised as to its impact on the brain, bouncing and would possibly bruise the brain. Side note, it was actually the Shirzais that brought up that issue once, and I never heard anything more about it, but they didn't seem to be sure.
I know, my page, I see people saying they have a rebounder. I know that when you look at, you can find these days on the internet, you can find supportive material for basically anything you want to do. I remember looking when someone told me that there were some beneficial studies showing beneficial effects, physical effects, and health effects of rebounding. But quite frankly, what I like to tell my patients to do is they're looking for an activity. Think about this. You'd like to have an activity that is natural. When I say natural, I mean it is the kind of movement that is ingrained within our human development and evolution over time. And over millions of years, the way we develop. And it's not a repetitive motion. It's not something that's over and over and over and over and over and over and over again the same thing. Because that's how you get repetitive motion injuries. So now take what I'm saying with a grain of salt. You could say, well, Dr. Weiss, running is a repetitive motion. It's the same thing over and over again for miles and miles and miles. Yes, you are right. Does that mean running overall is bad for you? No. Running in general is very good for you. However, you have to be careful the way you do it, because if you're not careful with the kinds of footwear you wear, or if you keep running, pounding on the same movements over and over again, you will get repetitive motion injuries of your knees, of your ankles, of your feet. So that, I saw a number, something like 80% of all runners, like endurance runners, high level runners, have had serious injuries of these body parts. So I think about the rebounder in the same way. You're bouncing up and down, 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 up and down. Some people who have had, some of my patients with osteoporosis have gotten rebounders to try to use that, and I'm not in favor of that. I'd rather you just jump on the floor. I mean, to me, that jumping is a more natural activity, and also I think it's better for load bearing, because there's not an elastic surface beneath you like in a trampoline. I like doing jumping exercises on firm surfaces without padded shoes, instead of the trampoline kinds of exercises. And I like doing them in focused amounts, not a million times a day. And I think that's the best policy. I would prefer that to the trampoline kind of equipment, the rebounders.
So I'm curious, what are you going to do for Thanksgiving at the farm?
Oh, well, we're just, the farm is usually closed on Thanksgiving. And we have never had a Thanksgiving event, a large event here. Usually, we're off with our families in different places. Over the past years, we've gone to my wife's aunt and her family, because since childhood she did that. But someday, I would love to have like a communal Thanksgiving on the farm, all plants, all the times, because that would be it would be like from our market, because you saw it, right? Taking everything from the field and market and having really a true harvest Thanksgiving. And you will get the first invitation to that, AJ, someday. What
Aw,
are you doing?
thank you. Okay, people, when you talked about the rebounding, were asking about what about ellipticals and stairmasters?
Here, take everything I'm saying with a grain of salt. In general, all exercise is good. Exercise is good. The question is how much of it, and are you doing it to the exclusion of other things that could be better? So, yeah, stairmasters. You know, elliptical. I mean, if you know, if I had to go upstairs or do a stairmaster, I'd rather go upstairs because it is a more uncontrolled scenario where you have to use other kinds of body, other kinds of proprioception and other kinds of muscles. Would I rather go cross country skiing or use like an elliptical? I'd rather do cross country skiing because you need all kinds of other faculties in order to negotiate. And the elliptical trainer it uses one kind of IQ, one set of muscles in a repetitive motion all over and over again. I'm not dissuading you from using it. Sometimes, if it's raining outside and you don't have snow, you should do that. So yes.
Absolutely. Well, Dr. Weiss, I wish you and your family a very happy, healthy Thanksgiving. And next month, he'll still be the third Friday of the month, but he's coming on a little bit later at 11 a.m. for The Doctor Is In.
Okay. Thank you, AJ, and happy Thanksgiving to everyone.
Thank you. And make sure you eat that grapefruit pith. That's what we learned today. Take care, everybody. And our next live show is Monday, November 25th, which is Goodbye Lupus with Dr. Brooke Goldner. I don't have live shows next week, but I am doing a live dessert presentation for the holidays for the Vegetarian Society of Hawaii. So if you get on my mailing list, you will